With the neuropathy, with the Abraxane, I had mine 3 years ago, but I had mine 3 weekly.
Weekly is more likely to cause neuropathy, 3 weekly is less likely.
Well, I had it 3 weekly,
And you still got it.
and then I had ACs, and it just exacerbated it. And it's been 4 years now, and it's no better, it's worse, and I trip over everything. It's going to stay like that now.
Usually nerves regenerate by 1 millimeter a day. So if you have any nerve insult happen to your body and it hasn't recovered in 1.5 to 2 years, it probably will not recover.
It's been 4 years.
Well, can I just ask one question, just to do with, the psychological side of it? Do you find that a lot of people that are diagnosed with cancer suffer depression?
Oh yeah.
Yeah.
Means
Because
if you
there's
look
a
at
high
the statistics,
majority, isn't there?
the way I see it is a large proportion of Australian or any Caucasian society, we are all under stress from our work, from our life and things. Depression, a lot of that subclinical is underdiagnosed. A lot of us have different varying sort of psychological problems. When we get stuck with a life-changing, extremely stressful social event such as cancer in our life, it is only natural that those emotions would get worse, and even the most normal and healthiest of us will become depressed. My feeling is when I treat women with early stage breast cancer, 35 to 40% get depressed. When I treat women with advanced breast cancer, at least 50% of them have low mood. Some require treatment for that, some don't. Some just require to talk, and obviously everybody is different, because some women are like, look, I'm in low mood, I don't want to talk about it. I'm in low mood, I want to talk about it. I'm in low mood, I want to talk, but I don't want to see a psychologist. I want to see a psychologist, I want to see a psychiatrist, and I want to have a medication. So it's that spectrum.
Yeah.
And it also depends, like some women may have a difficult family relationship, sometimes relationships breaks down, and obviously it's my role to try and support my patients during that time. Like I've had a couple of patients who unfortunately their relationships broke down because the relationship wasn't good to begin with, and when it curved and the bicycle caved under the pressure of the cancer. So it is only natural that you will feel sad and things. So I always try and work out which of my patients might help, and I try and implore, but at the end it's patient's personal choice. If they refuse to talk, they refuse to listen, they don't want to see anyone, I can try and keep probing, and if sometimes they don't listen to me, I try and ask their family members, I ring them up. I sometimes get my nurses to go and see, because I sometimes find that patients don't like speaking to doctors, which is very interesting. Like I will see somebody in the clinic and they'll say, yep, I'm great, I'm perfect, I'm 100%, because they are worried that the doctor might stop the chemo. And then, and then they go there in the back of the chair, and 5 minutes later, the nurse calls me and says, this patient's crying, she says she's had enough. So we see that.
Yeah.
You now know, though, that this group exists and you can send your patients to us.
Absolutely.
And we know from our evaluations that the women do every 6 months that people do come in very distressed with depression, as you know, and anxiety. And over time, in that first year, everyone comes back to within the normal range on average, or the averages. So
I think it's
the group actually has that beneficial effect.
I think it's very important as to what your expectation and understanding of your cancer is. If you are going with unrealistic expectations and haven't been told that you may only have 1 to 2 years to live even with treatment, then every time your cancer is going to get worse, your world is going to fall apart. And it is that openness and transparency. And whilst as doctors we are not gods, we can only give you an average. But it is also important that you at least know the ground where you stand. And I find having that information empowers women and tells them and their families to do things.
Vikram, we have to finish because Sandy's here for the next thing that starts at 11:30. But no, we can do that. But you have, yes, you have given us, I think, the idea of we decides and weeds, and Smarties are going to be part of our group from now on. So we have, they're not Smarties, but they're chocolates, and a bit of, well, it's not we decide, but it'll.
Thank you.